Good morning, Jazigreens. How are you guys doing today? This is Friday, July the 25th, I believe. I'm on my way over to the gym so I can go work out for about maybe an hour, maybe 45 minutes. I'm not sure. Of course, I just woke up about 45 minutes or 30 minutes. So yes, today, I have to do that, and I've got to go to the doctor's office to pick up my colonoscopy prep. And yes, this vlog is all about the colonoscopy prep and everything that I have to go through. I'm going to show you guys what I can show you. I definitely, I'm pretty sure, no. I won't be able to show you not even a little bit inside of the surgical room because they're going to put me to sleep. I kind of wanted to do it awake, but I don't know if my insurance is going to pay for that. So, and I'm not going to pay any cash for it. So, yeah, I just want to try it, being awake, but then I don't know. I'm just going to ask the anesthesiologist when I do go, how does it feel if you do stay awake, when they insert that probe inside you. Ooh, because they go all the way in the intestines. I don't know about that. And I think it curves and stuff. I don't know. I don't know. I'm having second thoughts about it, even if the insurance did pay for it. But anyway, this is what this vlog is about. I'm going to take you on a little bit of a journey from the day I started, and when I finish it, I'm just going to give you some information about it and just kind of like show you my, what I went through, and maybe to help somebody else to decide, to go ahead and have that colonoscopy. I'm also going to give you a little bit of information regarding the colonoscopy, specifics, statistics, whatever. It is now, 7:54 in the morning. I was going to leave about 7 like I normally do sometimes, and get there maybe almost 7:30, but I said no, I wanted to finish listening to something I was listening to on YouTube. It was the Word. The Word, and I normally do that anyway before I leave, but I wanted to, and sometimes I listen to it in my car, but I just wanted to listen to it, at least the majority of it, at home. So anywho, then I have another stop to make. I think I've got to go by the bank real quick and back home, but yeah, that's what's happening on this vlog. So I hope you guys will be inspired, some kind of way be inspired, and hopefully to decide on doing taking the colonoscopy if you need it. So I'll check back with you guys later on that. Hey Jazigreens, how are you? This is the next day. I just want to show you guys the few things that I bought for my colonoscopy prep. Some of the things I can have, like liquids and foods and whatnot. Okay, first off, this is a little bag that they gave me, the doctor's office. So the first thing is this Miralax, which is not called Miralax, but that's what it's called. It's a laxative. This is a powder substance. And I've got 2 packs of the Gatorade. I guess this is Gatorade flavoring. It's powder, so Gatorade flavor. And let's see, it's a cute little bag. I'm gonna keep it too, use it for something. And then I have some Docalax. Okay, the first thing that they told me to do is, which I'm going to pour half of this water out, but let me show you what I bought first. I got a box of reduced chicken broth in case I get hungry. It's clear. They said I could have either chicken or beef. I chose chicken. And I bought this gallon of water. I've got some bubbly. I have more in the refrigerator, but I'm just showing you just a couple of them just to let you know that I can drink them because they're clear. They said as long as it's clear and you can see through it, then that's fine, which it is, and I like this. Or if I don't want that, I can choose to drink some Gatorade, and this is the lime. Is it lemon lime? I can't tell. Lemon lime or orange. These are the only colors that I can have, so they say. And then, you know, you can have some apple juice. Now, I feel like I'm not going to need all this, but I just wanted to be, just to have some things on hand, you know, and if I don't get around to it, somebody might want to drink it. And then I have some cabbage, which I made earlier. Hold on. And I've been eating on that. This is the 3-day prep that I'm doing right now. When I say prep, you know, 3 days before the colonoscopy. So I'm just showing you that I made some cabbage to eat on for today and actually yesterday. The first and second day. So this will be Monday, which I had some, and today is Tuesday when I'm filming this, so I can have some cabbage. Tomorrow, I can't have anything, but I'll tell you about that in a minute. So what I will do when it's time to drink this stuff, oh boy, this is a gallon water, so I'm going to pour half of it off, and I'm going to mix this entire bottle of the Miralax along with the 2 Gatorade packs here. All 3 of these things go into the half bottle of water. Then I'll mix it up really, really good, shake it up, stir it up, whatever you want to do. And then that'll be it. But I just want to show you, this is just a little bit of carrots and cabbage I'm about to eat now because I haven't had anything in my system except for coffee and water. Bon appetit. It's good. The only thing about cabbage I don't really like that much is that it produces gas. Now, they said I can have it, so I'm just going to eat small amounts of it. Not like, you know, get extremely full or anything like that. Just eat very, very light. So I'm going to go ahead and finish this up, and I will see you guys for sure tomorrow on the prep day. Good morning, Jazigreens. It is Wednesday, July the 30th. Now, how could I forget that day? Because it's the day, the official day of the prep. Okay, I'm ready. Okay, I was able to have a normal breakfast. So what I did was I don't normally eat hash browns. I don't eat that stuff, but for today I will, something a little more heavier. So they said that I can have a regular breakfast before 10 a.m. So I had it around 9:30, 9:35, no, 9:35, 9:40, along with a half of a tortilla, just something to, you know, to get the grease out of the, to absorb some of the grease. You know, I don't want to be having a whole lot of grease in my system. And I didn't put a lot of oil in the skillet anyway. Let me put you guys down. Now, I'll wait. Yeah, so, yeah, I had that, and I'm drinking on my water. They say the more you drink, the more the prep, you know, the better you do with the prep. So I'm going to drink some right now before I talk. Oh, I'm out of breath. Part of me is a little nervous anyway. I don't know why. I've done a colonoscopy a few times before. It's just, I think it's just psychological. I really do. I'm not ready for the going to the bathroom part. Not ready for the drink either, but I can deal with the drink a little bit better than the bathroom, because once that bathroom cycle starts, ooh-wee, it's like, watch out. I just hope that both bathrooms do not be occupied. You know, Aaron in one and Sam in the other. Otherwise, I may have to think of something else, okay? I'm not going to say, because I don't want to be giving TMI. I don't want to be nasty, but you can just imagine what I would probably have to use, you know, in place of the bathroom. So hopefully there is one available for me. I think I've had 2 of these, or 1. I think 2. It's now 10:47. Yeah, I've had 2 of these, and I'm about to down another one. But before I do that, I'm making some Jell-O. They said you can have Jell-O, and I don't really want any. I'll just eat it if I feel like I need something to eat. Because Jell-O, this pack it's got 19 grams of sugar. You know, I guess if you eat the whole thing. This is orange, and they said you can have lemon, lime, or orange. These are the only colors you can have, so I will probably just eat a little bit of it, not much. Yeah, I've got this water boiling, but I think I did the directions wrong. It says to boil 2 cups of water and then add 2 cups of cold water. So I've got to do this all over again. I messed up. Oh, man. Okay, I got my 2 cups of water boiling. When it starts to boil, then I can add 2 cups of cold water into the pot. And then after that, I just finished the directions. Kind of confusing. I was like, 2 cups of boiling water and 2 cups of cold water. It says add the boiling water to the gelatin mix. So I gotta get a bowl, pour this stuff into a bowl. So when it boils, pour the hot water in. And then after that, wait a minute. Stir for 2 minutes until completely dissolve, and then stir in the other 2 cups of cold water. Okay. And I've got some green lime popsicle, and I like the popsicles better. So I will just deal with that. But let me read the instructions to you that I got from my doctor. There's 2 sides. Here's the first side and the second side. The first side is the directions before the procedure, before the colonoscopy, and on the back is the day of. So let me read it to you, because I wanted to read it to you, but so you guys will know. Okay, let's see. Okay, it says the facility will contact you 1 to 2 days prior to give you a set time of arrival, which they did yesterday, which was Tuesday. They told me to arrive there at 9 a.m. I said, okay, that's good. Because I didn't want any like 4 o'clock, 5 o'clock, 6 o'clock in the morning. That is just too early. So I was hoping for something around that hour. That's a good hour. So I'll be fasting and no food, no water up until all that. So I know when this is over, I'm going to be hungry and need some water. Okay, so they did that. The procedure date is Thursday, July 31st, 2025. To ensure a successful exam, please follow all of the instructions carefully, which I'm doing the best I can. I do believe I'm doing it. It says you will need to arrange a ride for the day of your exam. If you do not arrange acceptable transportation, acceptable. I wonder what is acceptable. Your procedure will need to be rescheduled. Patients must bring a current list of all medications to the endoscopy center. I don't know why. They already asked me all my medications on the phone yesterday, but I'll just bring them anyway, just in case. If you must cancel or reschedule your appointment, please call our office as soon as possible. Now, get this. There is a 3-day cancellation and reschedule policy. They charge $200. Did you hear me? $200 for no show. Ooh, well, I'm going to be there, because I'm not going to be charged no $200. Because, you know, there's some people who just cancel and don't show without even calling. So that $200 really, it'll make you think. Okay, now I know we are past all this, but I just wanted to read it to you because I meant to read it to you yesterday. 5 days before the colonoscopy, which is already passed, patients taking iron, aspirin, NSAIDs such as Advil, Motrin, ibuprofen, naproxen, if I'm saying that right, naproxen, should stop these medications unless otherwise instructed by your physician. The only thing you can take is Tylenol, which Tylenol does not always work, especially for a headache. It's recommended for pain or headaches prior to your colonoscopy, just because of that. You may still take all of your other regular medications if you have thyroid, diabetes, high blood pressure, high cholesterol, whatever medications. Patients on anticoagulant therapy, like blood thinners, such as Coumadin or, Plavix, Plavix, should stop these medications unless otherwise instructed by your physician, which I am not on any of them. Now, 3 days before your colonoscopy, which I had already completed that yesterday, it says to stop, and they put it in black, bold letters, stop eating any raw vegetables containing seeds. Cooked vegetables are okay. Now, I had some cabbage and some regular, my kale, lettuce, and cucumber. But with the cucumber, I opened it up and took all of the, the seeds that are in the cucumber. I took it all out, scooped it out really, really good. There's not one seed in my body. And I did not use any salad dressing, which is so boring. Ooh, I tell you, it was hard to down that. I could have put something on there, but I think my Italian dressing, I think it has, yes, it does have some red little specks of whatever that is, seasoning, whatever they put in it, red. And so I was kind of like leery about if I should do that or not. So I just chose to eat it without any anything. Just eat it just like that, chew it up, swallow it. And I did okay. Then it says no popcorn, you cannot eat that. No corn, which I don't eat. I don't eat these things anyway. Nuts, I do. You cannot have nuts, and stop any fiber supplements until after the colonoscopy. Now, I don't know if, because I do believe red beans is considered, it's protein, but it's considered fiber, I believe. So I just chose, just don't even eat it. I just chose not to eat it, and it's red anyway, so, and I'm not supposed to have anything red. Okay, so, but come tomorrow, Thursday, when it's time to eat dinner, I'm going to have me some red beans, okay? I may wait till Friday. Then it says avoiding fibrous foods, which yield more effective bowel cleansing and allows your doctor to perform a more thorough exam. Okay, that was for the first 5 and 3 days. Now, today, Wednesday, July 30th, 2025, the day before your colonoscopy. It says you may have a normal breakfast before 10 a.m., which I did have. I had, because I don't have a whole lot of food that I could eat, and I just chose to have 2 hash browns and a half of a tortilla. Okay, so I had that. Ooh, here's somebody shouting. I had that about 9:45 Then it says, the rest of the day you must be on a clear liquid diet. Your clear liquid diet may not include red or purple liquids, alcohol, milk, non-dairy creamer. Can't even have my coffee with creamer in it. Not even non-dairy. Good grief. Noodles. It says non-dairy or dairy. Noodles or vegetables in a soup. No pulp, no juice with a pulp, and no clear liquids you cannot see through. Okay. Make sure to drink plenty of liquids throughout the day. And this is what I'll be saying to myself if I feel like it's getting a little rough. The more liquids you drink, the better your prep will be, Liz. The more liquids you drink, the better your prep will be, Liz. So I'm going to say that to myself. And psychologically, that helps you get through it. Now, then they have some information pertaining to diabetics. So I'll read it to you. I'm not a diabetic, but if I were, this would apply to me. It says this only applies to diabetic patients. The day prior, only take half the dose of your diabetic medications. Do not take any long-acting insulins like Lantus the night before your procedure. Okay? Now, the things that do pertain to me, she highlighted them in pink, you know, things like this. Okay, this is what I can have to eat. It says, eat and drink these things during the prep. Now, I've already had my breakfast, so what I'm doing now is just trying to fill up on water. So after I talk to you, I gotta get down some more water. It says you can have apple juice, which I have a few of those little kitty little bottles, you know, those little boxes that I showed you. I don't know if I'm gonna drink all this. I may not even need it, but I just want to have a variety of things. You can have white grape juice, white cranberry juice, not the red, which I don't like the white anyway. Black coffee. Now, I thought about it. You know me and my coffee. It says you can have black coffee, but no milk or creamer. Sugar is okay. I don't know. I'm probably going to skip the coffee because I don't like it black and I don't like it with sugar. I taste it like that and it's just, ugh. It's just, you get the little sweetness, but it's just nasty because there's no creamer. And I like creamer in mine, so I forget the coffee today, but to come tomorrow, or not, probably not tomorrow. I'll probably have some Friday. You can have tea, I guess, with sugar in it. It did not say if you can have it with, I don't like put sugar in my tea or coffee. I would rather put honey in my in my tea, but they didn't say it, so, and I'm probably not going to have it anyway. Then you can have chicken or beef broth, which I do have the chicken, and I showed you guys that. I have orange and yellow Gatorade. You can have either one of those, and Jello, yellow or orange. I was looking for yellow, and I did not see it, so I just grabbed the orange. Orange is not really my favorite flavor anyway. Neither is eating Jello. I don't really like Jello that much, but if I feel like I need something, I'll probably eat it anyway. Then at 1 o'clock p.m., which would be in 2 more hours, take 4 tablets of Docalax tablets with a 12-ounce glass of water. And I showed you guys those tablets, and when I get ready to take it, I'll show you again. You will then need to mix the Gatorade packets that I showed you and add the entire bottle of that Miralax into a half gallon, which I have that water, and I'm gonna have to pour half of it out because that's a gallon of water, so I gotta take out a half and just keep a half in there. A half a gallon of water, then stir until completely dissolved in a large pitcher. Place the solution in your refrigerator. Drink plenty of liquids in between your prep, in between. Then at 3 o'clock p.m., that's when it all starts. Begin drinking the solution. I make that face because, you know, if you've never had a colonoscopy prep, it doesn't taste bad, but it doesn't taste delicious. Put it like that, okay? But you just drink it. It says to take small sips of the solution every 15 minutes. Every 15 minutes over the next 2 to 3 hours. Then, at this time, you only need to finish half of it, which is 32 ounces. So 32 ounces is like 4 times 8 is 32. So 4 8-ounce glasses of the solution. That's pretty good. That's not bad. Then the second half to be refrigerated and will be finished after 7 p.m. Then it says tip, if you feel nausea during the prep, take a 30 to 45 minute break and continue drinking the solution at a slower pace. I believe I'm going to be just fine. No nausea. All the other times I've drank this solution, I never have had it. I pretty much can down liquids pretty good when I'm not drinking it with food. Then continue drinking the solution throughout the night. Oh boy, until midnight. Midnight? I gotta be drinking that mess to midnight? That's a long time. Yeah. That's what it says. Making sure to finish the entire solution by midnight. So midnight is the cutoff time. That bottle has to be empty, and it will be, because I feel like I can do it. Make sure, now this is what I'm not going to do. I already told them and they said it was okay. Make sure to take your morning blood pressure, if you take blood pressure medicine like I do, or heart medications. I don't take heart medications, but I take high blood pressure medications and my allergy pill. It says to take it at this time if you take any. Now I'm not doing that because it's supposed to be morning, and I asked the office and they told me that's fine. I'll just have to take it after the prep, which will still be in the morning, so I can still take it then. Important: do not drink any liquids within 4 hours of the procedure. So I'm supposed to be there at 9. I don't know when they're going to start. 8, 7, 6, 5. So no liquids around those hours. And that's it. That's all the instructions that I have. And then on August the 14th at 4 p.m., I will have a telephone interview with my doctor or the office staff giving me my good results. And I'm expecting a normal colonoscopy test results. Okay, everybody, it's now 1 o'clock, so now I'm going to take the 4 Docalax tablets with 12 ounces of water. So I've got a water bottle. I'm just going to measure it in this measuring cup here so I can be exact. That's cute how they put it in a little plastic bag. This other 2 is for later on, 7, so... Okay, Liz, don't drop these pills, whatever you do. Wow, they don't make it that easy for you to get them out, I tell you. And I got these nails. See my nails, guys? I got my nails done yesterday, Tuesday. Okay, here's one. I don't know if you're supposed to take them all together. Yeah, why not? They're so teeny tiny. Almost done. Oh yeah, I called the office before I came back to you guys. I wanted to know if I could mix this stuff here with you know, my bubbly sparkling water that I like to drink. They said no. I'm like, why? It's clear. It's because it's kind of like acid, you know, bubbles, and they don't want to have bubbles in my stomach. I said, oh, okay, well, that makes sense. That's why they want you to mix it with water. And I was able to go ahead and measure my water out. You know, this is half a gallon right here. If I filled it all the way up, it would be a gallon. So, okay, that was 12 ounces. Now, this is the Miralax that I'm mixing in here. Take all this paper off. Oops, come on now, don't spill. I'll be throwing that away. Now I'm gonna go ahead and open up the Gatorade lime, green lime, something like that. This is supposed to flavor this stuff. You know, this is good, but ugh. So this is your flavor. I better put my glasses on. It helps me to see better, you know, when I'm doing things like this. Now I'm gonna put this in the refrigerator, and I'm just gonna have a seat on the couch and wait till this DecoratingwithLiz works. Okay, I'm about to sit down and have me my first popsicle. Okay, and now I'm watching B Loves Life. I don't know if you guys know who she is, but she's a mukbanger, and her son Darius. So I'm gonna enjoy watching them eat delicious food while I eat this delicious popsicle. I'll see you guys about 3 o'clock, okay? Not bad at all. That flavoring Gatorade packet, the both of them, makes all the difference in the world. I taste a little bit of very minor salt. Not to say it's salty. It's not salty at all. Those flavor packs of Gatorade is like, it does wonders. I'm telling you, this is so easy for me for right now. We'll see how it goes later on. I did it. It is now 4 o'clock and I finished 32 ounces. I had 4 of these, 4 8-ounce bottles. So totaling 32 ounces. So now what I have to do is just wait for the solution to work. I have not gone to the bathroom yet, but now between now and 7 p.m., I'm just going to just drink liquids. The more you drink, the better the prep will work. Told you I was going to be saying that, and that's what it says on my paper. So in between drinking and things like that, if I do get hungry, then I may have some broth for dinner, or I may just have some Jell-O. So that's the process so far, and I'll be back with you guys a little after 7. So. Okay, guys, just another update. It's now 7:30 p.m. It's still a little bit light outside, and I'm doing good. This stuff is, it tastes so good to me. I kid you not. It tastes like Gatorade. And I probably told you that before. I don't even know if I said that, but yeah, it tastes good. I have gone to the bathroom a few times, and I took the last 2 DecoratingwithLiz tablets at 7. So yeah, so it's 7:30 now. I gotta start drinking again. They just want you to sip, pretty much sip on it, you know, because I am drinking, you know, everything within 15 minutes. So yeah, I just wanted to come back on and tell you guys that I like it. It tastes good. I am done. Yes. Woo-hoo. It is officially 9 o'clock p.m., guys. And I've been drinking that stuff since 3 o'clock this afternoon. Wasn't bad at all. I'm telling you, but I'm so tired of the taste of the Gatorade. Because I have Gatorade in the refrigerator. I don't even want it. I told hubby I'll probably drink that Gatorade some other day when I'm, you know, when I've got all this Gatorade solution taste out of my system. I'm serious. I don't want no Gatorade, and I don't even want the Jell-O. I told hubby he can eat it, you know, eat some if he wants. Aaron can have it. I do not want it. But I have 1 popsicle in there. I want to finish that popsicle because it's good. Like I feel bloated down at the bottom. So that's how I feel. Just a little bloated, nothing bad. I must say this is the best prep that I have ever done. You know, with the past doctor, I had to drink that whole entire jug. With this particular doctor, I'm just so glad it's half. I'm so happy. But anywho, guys, that's all I'm going to share with you tonight. See you tomorrow. Good morning, everybody. It is Thursday, July 31st, the day of my colonoscopy. So it's now 8:30 and I'm waiting for hubby to come downstairs. We're getting ready to leave. I want to get there a little bit early so I can find a good parking space. I made it through the night, I tell you. Around 4:30 or 5 o'clock, I went to the bathroom about 2 or 3 times more, and I stayed in there a little longer, and I'm thinking to myself, come on now, I gotta go to sleep. I don't have time for all this, but I made it through. It wasn't bad at all. It wasn't bad at all. I'm just very happy about this type of prep that I took. It's so much different from what 5-6 years ago that I took this test. So yeah, I made it through. I'm ready. I guess I'm ready. I mean, you know, I think everybody would be a little bit nervous to go under, you know, the anesthesia. But no, I'm not really nervous because I've had this done a few times before. But how many of you know? I mean, you can still be nervous no matter how many times it is. Just the fact that they got to put you under. But then it's a good feeling when you know you're going to sleep and you won't know what's going on. I already know the process of what they do during a colonoscopy because I've seen a lot of videos on them. I searched YouTube recently, and I just wanted to get some more ideas or some more information on what happens because I've never known exactly what they do and how they do it. It's interesting. You guys should check it out. Just check out surgical procedures, colonoscopies, and it'll come up. It's only if you're interested, but I was interested, so I was looking at a lot of them, just getting some feedback from other people who have had it done and what they experience and whatnot. So yeah, but anywho, I'm gonna go. I'll see you guys later. So. Okay guys, almost my turn. This gown on and this hat thing on my hair and my little bracelet, so I am ready. Okay, Jazigreens, I'm back home. It's now 12:50. Oh, my head is hurting because my blood pressure is still up, which I took one of my medicines called clonidine to bring it down tremendously. It's too high. It's very high. Well, the doctor came in and told me that I did well. He found a small polyp. He said he removed it and he sent it over for biopsy, and he does not suspect that it's cancer. So I'm believing the same thing. No cancer in Jesus' name. But I made it through. We got there a little bit before 9 o'clock. And I think they called me back about 7 or 8 after 9, minutes after 9 o'clock. It was very fast. It was in and out. Not in and out, but you know, I was there a couple of hours. Let me see. They took me into the operating room about 10:20. Because I asked the anesthesiologist before he started working on me. I said, "What time is it?" He said, "It's 10:20. I said, "Okay, good," because I gotta let my viewers know, my YouTubers know what time I went in. And he said, "Oh, you're a YouTuber?" I said, "Yeah, I am." He said, "Well, you might not remember after this anesthesia, but I remember. I don't know why they say the anesthesia they give you, it'll make you not remember." Well, I remember everything. I remember all the details, so I don't know what they're talking about. I do remember everything leading up to when they took me back there and started the IV. The young guy could not get the vein that well, and I was trying to help him. And he says, "Oh, patience, patience." And I'm like, "Oh, I'm just trying to help," you know, because I know my veins better than, I know how my veins work more than he does. He doesn't know me. But he said, oh, no, I appreciate your help. So I thought to myself, well, just be quiet, Liz. Let the man, let him struggle if he wants to get this vein. I know my veins more than he does. So he finally got it. I was trying to advise him to try the left side. And he said, no, they really prefer, since you're going to be laying on your left side, they prefer the right arms. I said, okay, all right, do your thing. Do your thing. So he finally got it. Actually, I advised him to get one of the veins on my forearm, and that's when he got it. See, I know my veins. Shoot, they try to make it seem like they know it all. I know my veins more than they know it, you know. Shoot, we be knowing ourselves, don't we? And so he got the vein, and then when they were taking the blood pressure, the cuff that they use, they put it on the upper arm, and it was actually a little bit too small for my arm because it would pop off. So then she put it on the bottom, and then it was given some higher numbers. Well, my blood pressure is up right now, and it has been. I know I'm going to have to follow up with my primary care because I don't know why it's been over a week now, close to 2 weeks, and the pressure has been up, and that's a little bit concerning to me. I don't know why. It shouldn't be. I'm eating good, I'm exercising, I'm losing weight, and I'm not taking in a lot of sodium or anything to make it go up, so I really don't know what it is, but it's just kind of making me a little nervous. So, but I believe that everything will work out. Everything's going to be just fine. I'm not going to panic. I'm going to try to be calm and trust that everything's going to be okay, and it will be. So, then when I saw him put in the medicine, the anesthesia, and through the syringe, and he said, you'll be asleep in about 20 seconds or less. And I'm like, oh, good, because, you get in that type of scene, it's freezing, you start shaking, you're a little nervous because it's just the whole idea of them working on you. I mean, I've had colonoscopies before, regular surgeries before, I should be used to it, but still, I never stopped to get a little nervous because it's just the idea of what they're all of what they're doing and working on you and stuff. So I started to feel a little drowsy, and I'm like, oh, yes, because it's relaxing. When I get ready to go to sleep, I like that feeling when they get ready to put you under. Ah, yes. And then I was out, and I had a dream of something. I don't know what it was, but when I woke up, it felt like I had been asleep for hours and hours and hours, but it wasn't that long, approximately 15 to 20 minutes, so they say. And I woke up, and they were talking and doing things on my body and my So they were working on my right side, doing something to me. I don't remember what they were doing. And yeah, I'm still groggy, from that stuff. And the medicine that I just took from my BP medicine that helps to really bring that pressure down kind of like fast, I have that in me too, so it's really going to make me feel... And I don't really like taking it, but it's high enough to take it. I need it because I can't seem to get the pressure down on my own. I'm going to have to tell my primary care, I see an NP, I'm going to have to see her soon or talk to her and say, hey, listen, I don't know what's going on with my blood pressure. It's been like this for about 2 weeks, and I've been having these real bad headaches, and that's an indication my pressure's up. I'm going to take you guys in the kitchen. I'm about to get my water. But anywho, I know I look drowsy. Don't I look drowsy, you guys? But other than the headache, I would feel a lot better if the blood pressure was where it's supposed to be. I would feel a lot better. So it's basically my head and just a little drowsy. And I just ate me a Lara bar, which is it's like one of those somewhat protein bars. That's all I'm gonna eat for right now. I haven't had anything to eat since yesterday at 9:15 in the morning. I wasn't that hungry when I ate it, just a little bit. Because like I told you guys before, I probably repeated myself. I do a lot of intermittent fasting, so I'm used to going long hours without eating, and I'm okay as long as I'm drinking water. I don't have the Larabar box to show you guys. It's one of those, I guess it's a protein bar. It's very good and healthy for you. So I just ate that and I feel light. And we're gonna go out later on to get some fast food. I'm just gonna get me a salad and bring it home and eat it with some beans that I cooked yesterday to prepare for the day, because I'm preparing my beans. I told my husband I'm cooking my beans. He said, well, I know you are. I said, yep, getting that pot, getting them beans in there quick. I gotta be prepared when I come home to eat those beans, because you know they starve you, you know, the day before without eating. You know, you can eat the first meal at before 10, and then after that it's clear liquids. But yeah, I don't know if I told you guys this, but I had to get up to go to the bathroom a couple of times between 4:20 and then I think about 20 minutes after that, and I'm like, okay now, I gotta get to sleep. So you just have to get all that stuff out of you, you know. And then my doctor, which I had never met before, he steps in, he waves at me, and I'm like, I've never seen him before, but I just wave back, hello, you know. And then after the fact, when they wheel me back to the recovery, because you're in recovery for about 30 minutes. The first 30 minutes, they're, what are they doing? Monitoring you, your blood pressure, and just all those numbers. And then I took the oxygen little thing, you know, the one that goes in your nose. I took that off, not completely off, because I feel like I didn't need it. Then the nurse comes back and she's checking my vitals, and she says, hon, I need you to take some deep breaths. Your oxygen is low. And I'm thinking, low? It doesn't feel like it's low. So I actually put it back on my nose because I took it off on my own. Probably shouldn't have did that, but I didn't feel like it needed any more oxygen, so I just I took it off myself. I figure if they want it back on, they'll tell me. Well, she did somewhat, you know. And then she did it twice. She said the first time, then 5 minutes later, I guess the oxygen level did not go up where it was supposed to be. And I'm like, okay, Liz, you better be a good girl. That thing on your nose now, because you don't want no problem. So she said, take some deep breaths. I took about 2 or 3, you know, maybe a few times, because I want to make sure everything is okay, you know. And then she said, okay, that's better. So, you know, they just monitor you. And if you have to use the bathroom, you know, if you need assistance, I didn't need any assistance. They just stood there with me as I walked. I just walk slow. And you go into the bathroom, and yeah, you come back, and they say, what else happened? I was still waiting for the doctor. I think I told you guys. Yeah, I already told you about what the doctor said. Okay. You have to forgive me for repeating myself. It's still the anesthesia. So, yeah, I told you about what the doctor said. And then, oh, yeah, so I guess he's an attendant, whatever he's called. I don't know his title. They get ready to wheel you downstairs in the elevator. And it's a really nice place, you guys. Beautiful place. I love that place, that building. On the inside is beautiful. And I showed you the suite, a little bit of inside the suite, what it looks like. It's really nice and new and just nice. And that's what I like to do. I like to go into places where it's a new building, nice, everything is freshly clean. I mean, very beautiful decor. That's what I like. Very nice places, not something that looks like trash. Stuff all on the walls. I don't like to go into places like that, because then it makes me wonder how well of a job you're gonna do. So I had to wait for my ride about 5 minutes, and the attendant was, you know, he agreed to stay with us, because, you know, by law they have to wheel me out, even though I probably could walk out there, and I know I could, but they have to do it for their protection as well as mine, because if I would have fallen, just what if, then there's a lawsuit. So they don't want that. And you are woozy and drowsy anyway, you know. But so the ride came, And then I told the guy, so he wheeled me on out, got in the car, and then I said goodbye. I said, thank you for your assistance. I thanked the little nurse because she reminded me so much of my daughter. She's so pretty, just like my daughter is. And she's really nice. I could tell she was a real young girl, probably younger than my daughter. So yeah, that's the process, guys. That was what I went through. Now tomorrow or whenever I come back on here, I'm going to give you guys, I'm going to sit down with you and give you some, I can't say that word, statistics. I'm going to talk a little bit about what colon cancer is and all of the, some information of what I can give you. Okay, I'm going to share it with you guys. That will be the next clip that you see. Okay. Okay, let's see, where am I going to start? I'm going to start where the day of the prep. Okay, I'm going to give you guys some information after that. But I want to let you know how I did and all that I went through, okay? Okay. First of all, what is a colonoscopy? A colonoscopy is a procedure that a doctor uses a flexible tube with a camera on the end of it. It's called a scope or colonoscopy scope. And what they do, it looks into your rectum. They put it into your rectum and your colon, and it can show swollen tissue, ulcers, polyps, and cancer. Colon cancer is also called colorectal cancer, which is a growth of cells that forms in the lower end of the digestive tract. Now, American Cancer Society says that including skin cancer, colorectal cancer is the third most common cancer diagnosed in the U.S. and the second most common cause of cancer deaths. But the good news is colonoscopies and improved treatments are making a difference. Okay? Today there are more than 1 million there are 1 million survivors of it's kind of hard to say that word, colorectal cancer in the U.S. I can't say it that good, so excuse me, guys. So it's very important to get screened for colon cancer. It really is. My mother had colon cancer in, I don't know if it was her 50s or her 60s. And thank God she survived it. I'm just glad that it wasn't anything too major. She did have to undergo surgery to cut a portion of her colon, and she had to go through, I'm not sure radiation, but I know chemotherapy. She had to go through that, but she made it through, so she was a survivor, and thank God for that. So, guys, please remind your family, remind yourself, your friends, whomever you love, okay, to get screened for colon cancer. It is very, very, very important, just like any other testing, for cancers, the breast cancer, all the skin cancer, all the other cancers that are out there. It's very important to get screened for all of them, okay? So, do your job. When should you start the screening for colonoscopy? Well, in the past, it was said that screening should start at age 50, but now they are stressing that screening for colonoscopy should begin at 45, actually, especially if you are Black, because of the risk factors for colon cancer. And the risk factors appear to be pretty high in Afro-American community or Black community, Black people. Unfortunately, it's just the way it is, Okay, in general, there are times, sometimes it might be due to genetics, a lack of access to care due to poverty, late diagnosis, poverty, poor diet, or other risk factors, which include a poor diet of high-fat diets, going to the fast foods, getting all those fast foods and high-fat foods and processed foods, eating a lot of processed foods, being obese, morbid obesity, diabetes, smoking history, excessive alcohol use, excessive consumption of processed meats, having a family history of colon cancer, especially the hereditary type, like for instance your parents, living a sedentary lifestyle, and certainly having a personal history of colon cancer increases your risk for future colon cancer. People who are not eating enough fruits and vegetables, which I love, those are my favorite foods. We must eat more healthy foods, guys. We must leave the processed foods alone. I mean, I know they're good, but all you're doing is feeding cells. You're feeding junk, inside your body. And it's not doing our bodies any good when we keep eating that crap out there. It's just not good. It's not even worth it. But, some people are not that strong to, make their mind that they want to change their diet. I am changing my diet, and I don't eat any processed foods. I'm plant-based, okay? So if I do go to a fast food place, I might get a salad, or, I don't know, a baked potato or something like that. But not even a baked potato. But if I want to get some healthy choice, I would get that without butter, steamed vegetables. I don't eat meat or fish, so I don't have to worry about that. But eating a high fiber diet is what's best, okay? And that's what I eat. I eat a lot of beans and legumes and things like that. So, that's how you eat healthy. And of course, you must exercise and do all those things like that. At least 30 minutes, 5 days a week, at least. You can do more if you want to. What can you do to lower your risk of colon cancer? I just mentioned some. You can increase your physical activity, at least 30 minutes a day. Increase your fruits and vegetables intake. Cut back on processed foods. I would say cut them out, not cut back. I say cut it out. That's what Liz says, okay? Because processed foods are not good for our bodies. Because they have found that processed foods or excessive amounts of processed foods and processed meats increase your risk for colon cancer. I just mentioned that. And if you smoke, quit. You don't need to be smoking. Discuss it with your provider about quitting. Lose weight. I know, hey, I'm still on the health journey, and it's still difficult, okay? My highest weight was 320 pounds, okay? Now, I've got 60 more pounds to lose before I reach my goal. So far, so good, but it's a struggle. As you get older, I feel, and I'm experiencing that it's harder to get it off. It's almost like I gotta work my butt off in that gym, not just working out, just really to decrease the foods I eat, the amount of what I eat. It's a struggle, but I'm determined I'm gonna get this weight off. And I am endeavoring to get it off. I wanna get it off before 2026. Okay, before my birthday, February 26th. Yes, I just gotta push, push harder. Yes, so that's a little bit of a fact. Those are a little bit of facts I can give you that I'm going to share with you today. Oh, wait a minute, let me go back. When I arrive there at 9, of course, they bring you back to the operating area, and they give you a gown to put on and some slippers in case you have to go to the bathroom. You won't fall. I already had my socks on, so I didn't need theirs. and they hook you up to a monitor. So they will hook you up to the blood pressure machine, checks your vitals. They give you a, I forgot that thing they put on your finger to check your pulse. Is it your pulse? I believe it's your pulse. Well, my nail is too long, so they put it on my toe. I told the lady, I said, why don't you just put it on my toe? And it worked. Your pulse, I believe it's your pulse. And they take your temperature, and yeah, they monitor you. It's a bug flying. So when they were all ready for me to go back there, the anesthesiologist, he actually came to the cubicle area where I was to talk to me and whatnot. And I'm always letting them know, because I deal with rheumatoid arthritis. I told them I have a frozen shoulder and the right elbow does not straighten all the way out. I told them, whatever you do, please do not try to extend this and break it. Be careful of my shoulder. Don't take my arm and fling it up, because even though I won't feel pain, but you could break it. Okay, so he said, no, we won't be doing any of that. So the nurse and the anesthesiologist, they wheeled me back to the operating room. And I wasn't very nervous. I was just a little bit nervous, but I knew that I was going to go to sleep. So that calmed me. I mean, just to know that they were going to put me to sleep was just very relaxing to me. I wanted to do it without being asleep. And I asked the anesthesiologist, I said, how would that feel? He said, you may feel some pressure, maybe some cramping, you know, because that scope has to go all the way up in your intestines. And I said, nah, it's okay. Knock me out. I do not want to, no. So he said, okay. But he was a really, really nice, very caring anesthesiologist doctor. Very, very nice. I felt very comfortable with him. I mean, he made me feel, I don't know, he didn't make me feel like, okay, let's get ready, let's do this now. He was kind of like, you know, talking to me as if he was my friend instead of a doctor. You know, he had the syringe and he was about to put the medicine that makes me go to sleep in the little, in my vein through that catheter, whatever it's called. I don't know the name of it. Don't quote me, guys. I'm not a nurse, but he actually did it in front of me so I could see it. And he told me, he says, okay, you're going to be asleep within 20 seconds or less. Before that, he had asked me to lay on my left side. The entire procedure lasted, they said, between 15 to 20 minutes. I asked them before. So he put the medicine in, and I'm thinking maybe about, seemed like about 5, because I'm counting the seconds. And all of a sudden I felt so relaxed. I felt everything just calm down inside me. And it felt so good to go to sleep. I'm telling you, that is the most relaxing feeling. I love going under anesthesia. I can't talk. I love the feeling of that because it just relaxes you. You know, and I'm not afraid. I'm not one of those who are afraid, or what if I don't wake up? No, I trust in the Lord. I prayed to my Heavenly Father that everything will work out fine and that I would wake up and no problems. And I just trusted Him. That's all I did. So then I woke up after, I don't know where I was when I woke up, because my eyes were closed, but I was in so much pain with my shoulder. I was like, oh, my shoulder. And I'm taking my right hand, trying to lift up. Oh my gosh, my left shoulder was hurting so bad, really bad, for about 5 to 10 minutes. And I just kept saying, oh, my shoulder hurts, you know. And I heard somebody say, oh, just be careful, hon. And I'm like, no, not be careful, just relax. I'm thinking to myself, what do you mean just relax? Don't tell me to relax and I'm in pain. That is the most insensitive, stupid thing to say to a patient. Here I am in pain. Why don't you offer some assistance? Oh, well, let me put this pillow up under you, hun, or maybe give me some medicine or something, or ask the doctor, can she have something, or maybe an ice pack, something. You know, I mean, I was annoyed. I didn't see who she was, but I just said to myself, don't ever say that to me again. I'm thinking this to myself. You don't know what's going on with my shoulder. So that annoyed me, okay? Okay, and then you have to have a driver to drive you back. Hubby wasn't able to drive me back home, so we had Aaron to come and drive us back home. He got a ride to the place, so he drove our car. We all, rode in the car together. And, you kind of feel like you can drive. You don't feel so sleep like that, but you still should not. Do not take a chance to drive. So I'm not saying just because I feel like, I can. I'm not telling anybody to take that chance. Do not, okay? I'm saying do not take a chance. Okay, so yeah, we got home, and yes, the rest of it, I think I explained to you before. Okay, so you guys got that information. But let me show you what my colon looks like inside. Okay, this is the sheet that the facility will give you, or the doctor's office. Okay, and it will have your name. It says discharge instruction, has the name of the procedure, colonoscopy, patient name, me, and the name of it, and date of birth, the time, July 31st, 2025 at 8:15 a.m. 8:15 a.m. I don't know why it says 8:15 a.m., but anyway, yes, this is what it looks like. These are images of the colon. I don't know if guys want to see that. You may not want to see it, but that's how it looks. The different images that they take, okay? Okay, and it says we perform your procedure due to an indication of screening for colon cancer, and it has a procedure code next to it. Now, the findings. They told me that they see diverticulosis. That's what they see on the left side of the colon. Also, they see they saw some hemorrhoids, which I'm not surprised about the hemorrhoids. I already knew that I deal with hemorrhoids already, so that wasn't really too much of a surprise. Hearing about the diverticulosis, that was. Let me go back. Before I got these results, they tested, they found a polyp. The doctor found one small polyp in the colon. He removed it and sent it for biopsy. Okay, it came back benign, but the polyp was precancerous. Okay, so go figure that. But thank God it did not come back cancer. So I have to get these colonoscopies every 5 years because my mother had colon cancer, and because of what they told me about the polyp being precancerous at that time. Okay, but thank God he removed it and everything looked good. So I will be going back in the next 5 years to have this repeated. Okay, now let me just give you a little bit information of what to be aware of. This is diverticulosis. Okay, diverticulosis is when pockets form on the wall of your colon and become infected. Diverticulosis can cause bad pain in your lower belly, fever, and change in your stool. Diverticulosis can often be treated with rest, special diet, and sometimes antibiotics. Eating a high fiber diet and working out at least 90 minutes a week may help stop diverticulosis attacks in the future. Okay, well, I do work out, okay, and I am I'm doing the best I can to eat a high fiber diet. I mean, how many people eat as high as they recommend? Very few. I don't know, but I'm doing the darn best that I can. I mean, I can only do what I can do, okay? Things to be aware of. Issues that could come from diverticulosis include a block in the colon, an infection, a tear in the colon, an abscess, or urinary tract infections. In rare cases, diverticulosis can be a warning sign for colon cancer. Getting a colonoscopy can rule this out. If you have not had a colonoscopy lately, talk to your doctor about getting one a couple months after you feel better, okay? Well, I'm always in contact with my doctor, so, they are aware that I will be coming back in the next 5 years to have another colonoscopy, okay? Let me see. Let me go back and let you know, as part of the general instructions, when you come back from your colonoscopy, which I did not let you know, it says you might feel gas or cramps for a few hours, which I did not. I felt nothing. This is because air was introduced to the colon during the procedure. You should start to expel the gas before you leave the hospital or the center. I don't remember if I did or not. I might have, I don't remember. However, if you have persistent or severe abdominal or stomach pain or swelling, please call the doctor right away, which I had nothing. You may resume regular medication, regular food, unless otherwise stated by your doctor. Be sure you have instructions on when to resume any blood thinners if you usually take them, which I do not take any blood thinners. You may notice a few drops of blood in your underwear, or you might see blood on the toilet paper after you use the bathroom. This is caused by irritation to the bowel during the procedure, and it is not a problem. However, if you have more heavy bleeding, or if the bleeding persists for 3 to more days after the procedure, call our office, which I did not experience any of that, thank God. Okay. Weakness and lack of coordination are the result of the medications that were administered to you. That's why they don't want you to drive or use any type of machinery, equipment, until all of the anesthesia has come out of your body. Okay, which I didn't. When I came back, like you guys already saw before, I was just, really sleepy and just wanted to go to sleep, basically. Yes, if you have any redness or swelling at the sites where medications were given, the IV, place a warm, wet washcloth over the affected area for 20 minutes. If the symptom persists for over 2 days, please contact our office. Then it says call our office. This is the doctor's office who did my procedure. If you have any fever of 101 or higher, or chills during the next 48 hours, okay? And otherwise, that is it. Okay, guys, so I'm going to leave you guys with this bit of encouragement. Please get your colonoscopy. I have to stress it. I know some people are not going to do it because everybody has their reasons why. Some people have fear, some people are stubborn and they just don't care. But I'm just going to tell you, please get your colonoscopy. Tell your friends, tell your family members, get screened for colon cancer. You don't want to wait until all of a sudden, oh, you have this, and then all of a sudden, fly, oh my gosh, sorry guys. And all of a sudden it's too late, or it's stage 4 and they can't do much. You don't want to get to that point, okay? So anyway, enough said. I thank you guys so much for watching. If you have any questions, please feel free to leave them down in the comment section. I hope this has been helpful and enlightening for you. I hope that I gave you some encouragement. I hope that you feel encouraged. I hope you have gained some type of information and knowledge on the whole process, and I'm glad that I was able to share my journey with you, okay? So if you are new here, please join the Jazigreen family. Just click subscribe. give the video a big thumbs up and leave me a comment down below if you don't mind. You don't have to if you don't want to. And welcome to the Jazigreen family. To all my faithful Jazigreens, thank you guys so much for watching and all your support. I hope you have enjoyed watching this video. Please let me know. Leave me some comments down in the comment section. I thank you so much. Thank you guys so much for watching. You take care. You be blessed. And I'll see you next time in my next video. Bye.